Thank you so much, Mr. Tandon, for that insightful presentation. And now we would like to invite Dr. Naveen Nishal on stage to please felicitate Mr. Ariman Tandon for his very insightful presentation. Can we have a round of applause for him?
Thank you. Thank you, Mr. Tandon. Thank you very much. All right, so you would have, one thing would have really established, ladies and gentlemen, that today we are not just talking very technical, very scientific about healthcare, but more importantly, this discussion today will lead into a very holistic approach, a very transparent communication. Now, since we're talking about a very transparent communication, if I could indulge all of us, because we've been sitting for almost about 40 minutes, so if I could indulge you into a little bit of a brain teaser. I'm calling this brain teaser, you would realize that. So if I could request everybody, as to whatever you're doing, have your full focus on me, and on the count of 3, give me a single applaud together. We'll try doing this, okay? So 1, 2, 3. I did think so. We'll try this again. If you're with me, if you're able to hear me and also understand me clearly, on the count of 3, please give me a single applaud. Okay? But we do this together. 1, 2, 3. We'll do this again. For the very last time, just to understand if you're all together. On the count of 3, ladies and gentlemen, we all together will do a single applaud. 1, 2, 3. Fantastic. We're almost there. Thank you. Now you can give yourselves a round of applause for being together with us. So you see that today will not just be a day where we will just discuss things, but we'll ensure that from time to time, with such brain teasers, we are very much present, right? And we will ensure that this becomes a very healthy platform and a very healthy communication as we go during the day. So with this, as you would have also seen behind me, that now the stage is perfectly set for our first panel discussion, and this one is going to deep dive into.
So we are moving forward to the goal of universal healthcare access. The conversation today must shift from isolated excellence to integrated system. And for a nation of 1.4 billion people, healthcare delivery can no longer function in silos. It requires strong collaboration between public sector and private sector, industry and policymakers. And this discussion designed to explore how public-private synergies can strengthen healthcare infrastructure, improve accessibility, enhance affordability, and ensure policymaker. And for this, we now invite our distinguished panelists to kindly join us on stage. Dr. Ritu Mittal Garg, Chief Growth and Innovation Officer, Fortis Healthcare. May we welcome her with a round of applause.
Welcome, ma'am. Please.
Mr. Amit Singh, Group Chief Executive Officer, Yatharth Super Speciality Hospitals.
Welcome, sir.
Ms. Hina Dhawan, Head, Country Public Affairs, Novartis, India.
Welcome, ma'am. And this session shall be moderated by Dr. Vishal Arora, Chief Business Officer for Artemis Hospitals. I'll invite you, sir, to also please take your place. And of course, we also hand over the baton to you now. The stage is yours.
Good morning, everyone. So I think half of my job is already done by Ariman with a beautiful presentation and in setting the context of Indian healthcare scenario. Today, we will try to bring a perspective of public-private partnership to this scenario and how we can together fulfill the dream of 1.4 billion people in the country. When we talk about designing a healthcare ecosystem for 1.4 billion people in the country, the challenge, one of the biggest challenge is integration. It is integrating policy with practice. It is integrating public infrastructure with private infrastructure. It is integrating technology with care delivery. and scale with sustainability. We are not designing a healthcare ecosystem for a single city, not for a single income group, not for a single care model. This requires collaboration at level we have never truly attempted before. Uh, I'll give you a stat here. So India today has roughly around 20 lakh beds, out of which 12 lakh beds lie in the public ecosystem and 8 lakh in the private healthcare ecosystem. So our discussion today is therefore very practical in nature. What change do we need to do structurally? What models can really scale? And what will define the next decade of Indian healthcare? Before I begin, let me introduce, I'm sure you must be knowing all the panelists. Let me introduce the panelists to you. I'll keep this short and focus on the perspective each of them brings to the panel discussion. So Dr. Ritu Mittal Garg, Chief Growth and Innovation Officer at Fortis Healthcare. She leads the span of strategy, digital enablement, and scaling new healthcare models, key elements in building integrated and future healthcare ecosystem. Mr. Amit Singh, Group CEO, Yatharth Super Speciality Hospitals. Amit has extensive experience expanding hospital networks beyond metro markets. He has worked closely on delivery models that balance affordability and access, particularly in Tier 2 and Tier 3 geographies. Ms. Hina Dhawan, Head Country Public Affairs, Novartis India. Hina brings a public affair and policy perspective, working closely with government, industry, and healthcare stakeholders. Her focus is on enabling collaborative frameworks that support prevention, outcomes, and sustainable healthcare policy. May I request everyone to welcome the panelists with a round of applause, please. So, on this note, let's begin the first session. My first question would be to Amit. Amit, you have managed large, complex hospital operations while ensuring clinical governance and quality. From a vantage point, what are the 3 most critical reforms India needs today to strengthen public-private collaboration and move towards an integrated healthcare ecosystem?
Thank you, Vishal. Thank you, VS, for inviting me today here. I think the 3 critical reforms, I would say, first things come in mind is about digital and data interoperability reforms. That's very, very important because let's remember this, healthcare can only be made scalable through the exchange of the data, not by building the hospitals, right? That's very, very important, right? Even if you see the PMJY scheme and ABDM, that's Ayushman Bharat Digital Mission Program. If you would like to create a tier systems in a delivery of the healthcare, because ultimately the primary care, secondary care, and tertiary care, if primary care will manage better, if triaging can be done in a primary care, and then secondary care, and then tertiary care, so the load of tertiary care will be reduced significantly, but that can only be done. So this shift of probably the we call it referring mechanism, referring pathways when we created it, it's only be possible when we have data interoperability, because then you would able to deliver the care to the last mile. So that is the first point, first reforms. Second, I would say quality, as initially speaker was talking about. So we don't talk about the clinical outcomes so far. We only accredit the infrastructure or the particular healthcare delivery, this thing. So I personally believe that the quality, the accreditation is going to play a big role. When we create ecosystems, it's about the comparability or more of the transparent mechanism where we can talk about the clinical outcomes. That can also gives us probably India will be placed to talk about the globally integration with some of the very clinical the reforms happening across the world, right? And by doing this good accreditations, of course, we all know that we can attract more global patients by having a JCI or a NABS, this thing. So that's quality is also very, very important reforms. Third, I would say more from the private perspective, private player perspective, is about payments reforms. I would say that there's something is like time bound, or something is like if the time bound payments, we can get it. If I know is my predictable cash flow, if I know my predictable EBITDA, probably it helps me a lot to spread to the tier 2 and tier 3 cities. So I think that entire ecosystem of this financing model has to be looked upon. So this is what I believe these 3 things is key as of now.
So Amit, that's a very insightful perspective. So my follow-up to you would be, if you had to pick one reform out of the 3, right, which would unlock the others, what would that be?
think that's the payment reforms, I would say the first, because that's somewhere it doesn't give a space or probably the flexibility for private players, which as of now 60-70% of healthcare being delivered, being taken care by the private players, to go to the next level of it. So I think that's one hurdle which we have. So I would say payments reform is important as of now.
Sure. I will just move to Ritu, and Ritu, I would want to understand from you, for my audience, like from an innovation standpoint, you lead innovation and growth at Fortis, right? From an innovation standpoint, which reform do you feel, right, can do justice, and as Amit talked about digital enablement, can do justice, and from a public-private partnership standpoint as well, innovation does not just see pilots across the country and they see light of the day. So what would that be?
In my view, I think if we were to really in spirit implement the digital health mission, that would solve for a lot. Because that would mandate, I think one of the biggest hurdles that we have is that we do not have a structured, standardized data. We are all in the silo. So you cannot create an integrated ecosystem and bring all the players together unless you are speaking the same language. So in my view, I think ensuring that we all have electronic health records and they talk to each other and they're accessible to patients and across the system, and we are able to make longitudinal health records of our patients. Right now, it's all episodic, and it leads to immense amount of, in my view, wastage. Because when a patient reaches to a hospital, many times the patient has undergone the same test at 5 locations separately, nearest to the house, by the GP, then one more doctor, then second, then third. The amount of wastage of resources that happen simply because we do not have data which is free-flowing, which is standard, is significant. So in my view, I think, and at Fortis also, a lot of our innovation effort is trying to get a data lake which can then talk to multiple ecosystems for future.
No, thank you, Ritu, for that insight. So it will be interesting to have Hina come in here from a policy standpoint. So Hina, you work with a lot of government agencies and the public, and you are the liaison between, say, private and the industry stakeholders. So from your standpoint, what needs to change for innovators to work more effectively with government to build value-based care and integrated care? So what do you feel would bring in that change?
Okay, we talk a lot about value-based care, but in India, that is my personal opinion, we have not been able to define what does value mean. We talk about value-based care treatments and all of that, but what does that eventually mean for a country from a public healthcare standpoint? Does it mean reduction in hospitalizations? Does it mean management of your morbid conditions better? Does it mean prevention for certain high-risk factors? That is something that we need to arrive first. Only then we'll be able to really, leverage on the potential of a value-based healthcare ecosystem in our country. That being said, and I don't think value-based healthcare ecosystem can be developed by government in isolation. It will have to be done in consultation with industry, with healthcare providers, with the patient groups all together, so that we align on the matrices that the government takes for this kind of a value-based healthcare ecosystem together. And how do we ensure that the systems which are siloed today, our primary care doesn't talk to secondary care, our secondary care doesn't talk to tertiary care, how do we develop that continuum of care? And as my fellow panelists pointed out, about the redundancy of certain interventions that happen, the tests happen. That only will come to fruition if we are able to bring in that continuum of care ecosystem. So first of all, from a policy standpoint, I think the government really needs to bring all of these different pillars of the healthcare ecosystem together and co-create these policy frameworks which actually start showing value-based healthcare outcomes. I'll give you an example here. We all know that cardiovascular disease is a #1 killer in our country. Close to 30% of mortalities in India happen on account of cardiovascular diseases, right? And then in India, cardiovascular disease sets in about a decade before it sets in as an example or as an average for rest of the world. And what are the avenues taken by the government there. The government is trying. There is an NCD program, there is Ayushman Bharat, there is an ST elevated myocardial infarction program, but all of them focus on events. There is very little concerted effort which is happening that, okay, fine, a patient has come in with an MI episode. What do we do to ensure that that patient doesn't come back into the system with a repeat event or a recurrence of that? How do we manage that better? That is happening in silos today. We need to come up with a outcome-based metric which forces the system to not only account for events, but also impose responsibility and accountability to ensure that recurrences don't occur. We are able to provide better care to our patients, and maybe in a bit, as in a country like ours, we are still way short of beds that we need to be able to cater to our population. If we are able to bring in those outcome-based matrices, we'll probably free up some of those beds and give more wider coverage to our patients. The second part of it would be on the preventive care aspect. We continue to focus on cholesterol, on blood pressure, on diabetes, on other cancers in a very siloed approach. What perhaps is needed is a risk stratification of patients. Put all of them together and categorize patients as high-risk cohorts, and maybe move more resources, more funding opportunities for patients which fall into these high-risk cohorts to see how we can most efficiently provide care to the patients who need it the most. There are examples which are there in the globe, in the country. There are those initiatives which are moving ahead, but it needs to be done on a more concerted effort. The last with respect to innovations, we need to create, as one would say, fast lanes for access and landing innovations in the country. Globally, innovations anyway reach India later. We need to have our regulatory system, our fiscal system in such a shape that innovations, A, they reach India faster, and B, when they reach India faster, we are also able to provide the same to our patients who need them. That being said, it needs a reform with respect to reimbursement, because a lot of Indians are constrained on account of affordability to be able to access those innovations. And when I say reimbursement, it just doesn't mean government reimbursement or public reimbursement. Even our insurance needs to be able to adapt so that innovations can get covered. IRDAI today has a guideline which says modern treatments and oral chemotherapies are covered under the policies. But we see patients struggling to get modern treatments covered under their insurance, or for oral chemotherapies as well.
Sure, Ina. I think we completely echo that, and the message is very clear that for the next decade of transformation in Indian healthcare, all the stakeholders have to converge, be it government, policymakers, or the service delivery people, or the tech providers, and they have to focus outcomes before service delivery. So that's a very clear message which is coming on the structural framework currently existing in the country. Moving on to the next question. So Amit, my question would be to you. So you have been, Yatharth has been doing good growth and announcing hospitals across, right? So kudos to that. And you have been at the forefront of that. So, and Ariman in his presentation clearly mentioned that there is a lack of divide, urban-rural divide. So what do you see, what are the reforms that can bring in and bridge that divide, where hospitals can expand outside metros and tier 1 cities to tier 2, tier 3 cities, and we can bring in healthcare accessible, tertiary healthcare accessible to the people of rural population, to the underserved currently?
So the issue is about the one is accessibility, and second is about the affordability as well. So accessibility for both, for let's say private players, for us to reach out to the the district level hospital and beyond that, right? And for patients to reach out to the and having access to the quality tertiary care facilities, right? So that's a problem. Now, how this can be done? So this can be done, I would say, it's with the model of kind like a hub and spoke under the PPP umbrella. That's very, very important. Under the PPP ecosystems, if you can do it. So let's talk about the primary care and the secondary care. Government has got a PHC, CSC, right? And then it's a district hospital. The issue there is about the bringing that specialities or specialists to this primary care or the district level hospitals, right? So there is a various mechanism. I mean, we can have a platform. Is like I mean, you might have heard the various states government is doing this kind of model, experimenting about the EPSC, ECSC, or even an EICU kind of concept, right? So if EPSC, ECSC, that the primary healthcare can be delivered over there, yes, the issue will come with about the training of those staff. So that can be taken care by the private players. Coming to the secondary care is about the district level hospitals where you need actually the bit of surgical care to be delivered. I mean, the surgery has to be done. Primary care can be a more of the conservative. Then it comes to the secondary care. So there also, I would say that through this EICU concept, and then making the doctors to be available, and also physically doctors can be perform the procedure or surgery over there. But this has to be regulated with a third hospital, which you call as the hub. That's where either it can be a private hospitals, bigger hospitals, or even a medical hospital as well. I mean, medical colleges as well, right? So if that ecosystem, if we create nicely, right, this the burdens can be reduced from the tertiary care, and that the primary care, those who deserve primary, those who are coming for the primary care can be delivered there, secondary care can be delivered there. The ecosystem will be managed by the private players. So the government, we can utilize the infrastructure support from the government. We can utilize, we'll talk about the financing separately, but the whatever the manpower or the clinical staffs there, the private players can train them as per their own requirements, right? And providing some sorts of I would say capex or expertise. That is what the private care job. So if you can create this ecosystems, I think that we would able to take this secondary and tertiary care to the last mile. That's A. Also, I would say, as I talked about, referral mechanism. This referral mechanism enabled with the, as Ritu said about the Ayushman Bharat digital mission, if data interoperability is there, I think that ecosystem can be managed very nicely. So this is what I think that we can deliver better quality care.
Sure. So what has happened recently, one of the state governments, without naming the government, has floated a tender, right? There were stakeholder consultations which happened, right? A tender has been floated where hospitals have been invited. Before the tender, the discussions have happened between the government and the providers, and the government wants to outsource their PHCs and GHCs to the public, to the provider, private provider, in terms of a PPP model. And as Amit rightly mentioned, that's happening, and that's the need of the hour when we talk about a integrated, future-ready hospital. And when we talk about accessible healthcare to the 1.4 billion people, where public infrastructure currently dominates the tier 2 and tier 3 cities. Now we have discussed something on the structural framework, and what is coming out clearly is digital enablement for future readiness. So let me bring in Ritu here. Ritu, whenever it comes to innovation, I bring it to you because you have been leading that, you've been driving that, and the hospital, Fortis Hospital, is known for the innovative measures. So from a leadership standpoint, if the hospitals have to prove themselves and have to come future ready, what all are the levers in terms of digital enablement? We talk about so many levers: digital enablement, maybe a CDDS system, clinical decision support system, or maybe interoperability. What are the challenges you see, and what are the levers with which you can make your hospital future ready?
So I think one of the most important, the critical factors to do this is actually change management and behavioral change. The single most reason why innovations fail, and I do differ a little bit, Hina, when you say that innovations come late to India. I don't think so. I think there's a lot of innovation that happens in India. Probably, in genomic side, the India started CAR T cells as 1/10 of a price. I mean, you can count probably 2 to 3 countries which have done that. Just like COVID vaccine. So there's a lot of innovation that happens all the time in India. It's been a hub of innovation all the time. I think what goes wrong with us on rapid adoption is one, lack of patience. Hospitals especially are very operation intensive. Everybody is living there for the moment. for today. You know, there's a lot of firefighting that happens in every single hospital, however organized we are. So taking a step back and being patient about investing your time, resources, bandwidth, and mindset to fuel innovation is very difficult. And that is why, at least for us, we decided to create a central function, because we would hear of so many people who approach us and then they would get lost into the system from one hospital to another hospital. And you know, there was no pathway for them or for us to, one, evaluate them properly, make sure that we are able to give them feedback, discuss our needs, and then operationalize that. So ever since we've created that function, that has really helped us. In fact, we are on verge of launching an incubator as well, which will then become a lot more structured for startups to work with us and help some problems, solve problems. So that's, I think, number one. Second, again, you know, over the time, you know, we tend to do stuff which has worked for us so far, and be skeptical about what's going to come. I know of my colleagues and friends, which, you know, till last year would be like, oh, AI output is very, you know, it's gibberish, it's not great. You change that in few months and, you know, the kind of output that is coming out from AI is unbelievable. I am sure that many of you are using it for personal, but I have used it multiple times, you know, sharing as a use case or as a mock, you know, patient history, and the kind of insights are unbelievable. The fact is that, you know, very soon the output of AI enabled decision support would probably be better than an average doctor. I'm not saying it would be better than everybody else. Obviously, that nuance and experience will be there, but that journey is significantly compressed. So the belief in that this is going to come, be patient about it, give it room to work, is going to be tremendous. I see next few years, both AI and genomics going to be very, very significant. Same lies with genomics. There's a lot of skepticism about, oh, what will we know? There's some gene mutation. Why do I need to know it today? This is what we used to say about cholesterol like 10 years ago. You know, what's the point? You know, earlier, you know, we would treat diseases. Then we said, okay, maybe cholesterol is getting, you know, it is getting impacted your arteries. So you started measuring cholesterol. You started taking interventions. Go a step further. Now there is a person where we know there is a genetic mutation. We know the patient is going to have a lot more cholesterol. And if you can do an intervention at that level, that's significant. But the benefit to many people in the hospitals is not visible today. And I think that's where your statesmanship, what is the vision? Are we living for a quarter EBITDA, or are we living for creating something that's going to be there for 5 to 10 years? And that's where the differentiation is. And if the mindset is that, oh, we are here to create a long-lasting healthcare ecosystem, which is doing meaningful work for next decade, and that stability is there in the leadership and at the hospital leadership and the clinicians. We're all in it together for a next 10-year haul. That's the only way the innovations will work.
No, thank you, Ritu. I just recall a statement in one of the conferences I was attending. So a veteran, a star doctor across the country, a question was put to him that how do you see AI replacing doctors in the future? And he very subtly reverted to it that AI will replace those doctors who don't adopt AI. And that's how it's going to happen. Ritu, but I have a slightly different view from you as well. So I will put you on the spot on that question. So many hospitals, everyone is eager to adopt digitally. India, in terms of digital adoption, especially in healthcare, is a laggard. There is a dream taken that by doing this digital enablement, I'll do this, right? But eventually, most of the livers do not see the light of the day. So as a healthcare leader, what is the typical mindset? And you guys have been doing a fantastic job there. So as a healthcare leader, how you have been typically changing the mindset to ensure that whatever digital levers are undertaken, they actually deliver for what they were taken for?
I think one of the very important aspect is the involvement of clinicians at the right time. You know, so clinicians, they like to work in a certain way that they have been trained for. They hate change. So if I'm going to put a very fancy system and say from tomorrow you're going to use this, I can guarantee you the adoption is going to be very difficult. it takes a lot of patience and involvement of clinicians, to develop any tool that you're doing and have that buy-in and tweaking with them to be able to deliver. Because whatever we are talking about here, right, in the healthcare, the center point of action is between a patient and a doctor. Everybody else is ancillary. We're all support. But ultimately, the entire action is between a patient and a doctor. So unless you bring that innovation and involvement of the central provider, we are going to have that issues. And it's easier said than done. It's a long journey. I mean, no way can I say that, there is a magic wand to it. There isn't. The magic wand is being persistent, patient, calmly and involving the clinicians in every single discussion. So in every forum that we do, for our senior clinicians, Pan-India and so on, which we do every quarter, there is an hour which is dedicated only for this. And yes, there is a lot of brickbat sometimes that, this doesn't work, that doesn't work. Yeah, that's there. My analogy to them is, just because you've got potholes in the road, you don't stop making flyovers. I wish that was the case, but that's never the case. Even if you were to make flyovers, there will always be potholes. So there would be time when internet connection will not work. That is a fact. That doesn't work even at Microsoft headquarters sometimes. But that cannot stop us. That cannot be the excuse of saying that we're not going to do this. Because many times you'll hear this, oh, Pele, we should fix this, then we will start doing that. Both have to go in parallel. You'll have to continue to make sure that your system is robust, but not wait for that to be fixed 100% because there is never 100% there.
Fair enough. So if I have to sum that up, so early consultation involving all stakeholders and change management. These are the three key levers which Ritu just spoke about. I will move to Hina. Hina, my question to you would be, we saw in the earlier presentation, NCDs. NCDs becoming the India's biggest healthcare modality, right? So what collaborative models between industry, hospitals and government can accelerate disease management and enable faster adoption of advanced therapeutics and digital solutions? My question to you, because you being the bridge between the industry and the policymakers, so what do you see that?
Okay, I'll take a cue from what Amit said and from what Ritu said. Amit spoke about, the need for PPP models to come in, and you also spoke about, some of the states leaning into PPP models also for their primary care, right? And Ritu very rightly spoke about the prowess of digital and AI tech to support the physicians in early diagnosis, in the right treatments and all of that. So if we bring all of them together, convert them into more or less, like a outcome hub for NCDs. Bring in the efficiency of the private sector, bring in the efficiencies that the digital ecosystem brings in, and look at models similar to a capitation model that works in Thailand, where incentives are given not only for the treatment that you provide, and also for the conditions that you manage. So the payments are linked to outcomes for your providers basis the right management that they're able to give to their patients. If all their patients have adherence to therapies, if all their patients are controlled for their blood pressure, for their cholesterol, for their diabetes, so on and so forth, early diagnosis with respect to oncology settings, genomics, maybe use those as genetic markers and see how quickly and how soon can you diagnose and prevent setting of chronic diseases. All of that clubbed together could probably be a solution that India could look at, but easier said than done. We are a huge country. We are, it's not easy to develop such kind of a model at scale in India, but maybe what we need is these kind of pilots to be done in small areas and see how they can be scaled up and absolutely lean on the advanced technologies that exist in India, be it digital and AI, because India has immense potential there. We can use our hub and spoke, take the treatment and the diagnosis closer to the patient without the need of an actual physician being there. So if we can do that, it will probably make us reach the patient faster, sooner, and with better managed care.
So if you were to pick one lever, which would move the needle fastest, what would that be?
Okay, I will maybe include one more aspect here. Innovations do exist in India. I do agree to that. And thank you, Ritu, for pointing that out. What we also need is to take those innovations to the patients. That is something that we need to work on as a country. How do we, and we talk about 1.4 billion population. There is scale for sure. How do we match that scale to the availability of the innovations and make them more affordable for the patients? Can we work together with the private sector, with the government, to arrive at some kind of, volume, outcome-based matrices to make innovation more accessible? That would be my takeaway for NCDs.
Again, everything boils down to integration of all the stakeholders. That's what is coming out clearly, be it the public policy makers or the private providers or the innovators or the tech providers. So everything has to come down to one platform to integrate and collaborate for the future readiness to the hospital. Now, we will move to a rapid fire round. So the rules are as follows. There will be 2 questions to each panelist. You will be required to answer in just 15 to 20 seconds. I've already got a time check from the moderator. So my first question would be to Amit. Amit, one model that best enables affordable tertiary care outside metros?
I think the one model which I would say, I think that lots of people have not studied it, but the bottom of the pyramid model, if you actually really study it, with the redesigning keeping in mind the cost, the delivery, about the financing, but without compromising on the quality. So if you can work it under the ecosystem of, as I said, about PPP and hub and spoke, I think that's gonna be a really game changer.
One mistake to avoid when you are scaling hospitals?
One mistake to avoid. I personally feel that, see, India has an enormous opportunity. I think it's all about setting your expectations, which area which you are entering into it. You need to really study that market and how you can leveraging it. It's about the payer mechanism, payment system, or the ecosystem surrounding. So I would say if you study well, I don't think so you will go wrong, because it's a huge deficit between the demand and supply. So I don't think so it's as such any mistake.
So all the ventures have been successful, so he can broadly say that. I'll move on to Hina. Hina, one partnership India must prioritize for managing NCDs.
One partnership.
India must prioritize for managing NCDs.
I don't think we can think of one partnership model for NCD burden that we have in India. But if I was to say that, I mean, maybe look at PPP to, to bring in the efficiency into the healthcare service delivery.
Perfect. One policy reform that could accelerate prevention first healthcare. We are focusing only on curative. 95% is curative, preventive.
Maybe have, like a backward referral or a hospitalization to primary care referral system in place, because no matter what we do in preventive healthcare, it's very difficult to, reach the size of the country that we have. But at least we can start from the patients who have had incidents. Start from there, do a backward linkage of tertiary care to primary care, and maybe start from there.
Sure. Ayushman Bharat coming up for 70 plus can include maybe out of the box thing, can include a preventive health check who have not claimed their insurance in the last year. So one preventive health check complementary, that's how you can also see it coming the way. Dr. Ritu, one innovation that will most impact patient experience in the next 5 years?
AI and genomics.
AI and genomics, to the point and very precise. One capability hospitals must focus for the next decade?
Data interoperability.
Data interoperability. Data is the key to do anything. AI, genomics, without data, why data interoperability? I'll just pitch on that for a second before I close. Today in healthcare, across the hospitals, we are using 25 to 30 different systems where the data is used. Right? The data has to go down to data lake. Most of the systems don't speak to each other, be it inside the hospital, be outside the hospital. Forget outside the hospital, across the hospitals. One hospital of a chain in a city will not speak to the other hospital of the chain in that city. So data is not interoperable within the hospital today. And what we are talking about, data interoperability across the country, which is a big lever, and which will transform the Indian healthcare, which has to be the future enabler going forward. So on this note, I would like to end this session. I'm very thankful for the esteemed panelists for their insights. To the audience, what is coming out very clearly is that India's future healthcare will not be built by one sector alone. It will be through partnerships and shared accountability. Thank you again. Thank you, everyone. Thank you for a wonderful listening. If you have any questions, we are happy to answer that. If you have any questions to any of my panelists, more than happy to take that up. Yes, sir. So if someone can pass the mic there. In the interest of time, we can take one or two more. So, yeah. Sir, if you can raise, your question would be to? Yeah, sure. Your question is to whom? Sure, please. So it's an open house.
Myself, Ashok Arora, I'm from Delhi, and it is regarding the screening of people, which should be made compulsory of every person, with just an ultrasound screening. Once in 3 years is enough to do whole body ultrasound, and any person found any disease coming up can be caught by a radiologist or a ultrasonologist. And it should be uploaded on the website, HIMS, etc., the government website, and it should be free and compulsory for every person above 18 years and regular intervals. Only then you can catch the disease young and treat them in an OPD or in a minor OT even. This is my suggestion to the government. I am trying it, but I am failure. To be very frank.
Sure. Ritu, would you like to pitch in your views? Yeah.
All I can say is I think instead of one test, because we cannot prescribe one single test for everybody. I think, yeah, but I will not going to pick, for example, a heart issue or a cancer issue. Yeah. So, I mean, I hear you, sir. And I think the broader point is that, there should be a mandatory health screening at some point.
Correct.
In whichever manner. Yes, thank you.
To the government, maybe 1 rupee per day.
Sure, sir. Point is well noted and taken care. Yeah. Anyone else? Any questions? So I think we're good to wrap this session. Thank you so much. Thank you, Dr. Ritu. Thank you, Amit. Thank you, Ina. Thank you for joining us on the stage. Thank you.
Thank you, Vishal, for igniting a lot of passion in the audience as well with this one. So as I thank all of us, I would invite Dr. Can I have the volume on this? Dr. Naveen to please step forward for a token of appreciation as we wish to felicitate our moderator and our panelist here, please. Welcome. Thank you, Dr. Ritu. Thank you, Mr. Amit Singh. Thank you very much. I'd like to thank Ms. Hina Dhawan, the head for Country Public Affairs, Novartis India. Thank you very much. Thank you, Dr. Vishal Arora, our Chief Business Officer, for Artemis Hospital for managing this so well and definitely bringing out the key points that we wanted to highlight with this discussion. Thank you, sir. If I could please interest everybody to give in a round of applause, ladies and gentlemen, one last time for all the panelists and of course our moderator for bringing across the topic so evidently under this session. Thank you very much.